Miami.
Okay, welcome. I am State Representative Paul Baumbach, and with me is...
State Senator Dave Sokola.
And it's time for our weekend Facebook update. We want to take advantage of this time. We've now completed a 3-week portion of our legislative session for 2021. So we thought it was a good time to look back, give you an update on that, of course, talk about the pandemic, look forward of what we see coming up, and take your questions and comments. Dave, any opening comments?
Yeah, I thought it was actually in spite of, the first day is always pretty much ceremonial, so you don't get much done there. The second week, our governor got inaugurated for his second term, so that day was pretty much a wash. And the following day, the president was inaugurated. So we really had 3 days that were very limited. And in the other 6 days, I think we actually accomplished quite a bit. Some very important items, especially related to COVID, and look forward to people getting ready to go back in the middle of March. So hopefully we'll have a very good 6-week. It's not a break. There's a whole lot going on. The joint finance hearings, as well as the prep for a lot of legislation. Our attorneys are going to be very busy, and the Division of Research is going to be very busy.
And there's, committee meeting, task force meetings going on, also doing very important work for the bigger issues, the issues that just can't be resolved in a week or two of planning, but rather ones that take months of bringing a lot of stakeholders together. And those meetings have been going on and will be continuing during this 6-week break with the quotes around it.
But I do want to point out there's along with being President Pro Tem, you have a lot of appointments. Most of them are senators, but in some of the committees and commissions and task forces that are involved, we do have appointment authority for private citizens. And if you're interested, if you know of one you're interested in, I can check. Val is doing yeoman's work helping me get through this. There's a ton of them. There was a backlog of things being filled, and we're going to try during this 5-week break to every week make a dent in what needs to be appointed. There are people who haven't been in office for almost a decade who are still listed on some of the things as the senator. So we're going to get through that. And I'm also working a little bit with Pete, because the ones that involve private citizens, we try to keep both political balance and geographic balance for those if they're statewide.
And by Pete, you're referring to the Speaker of the House,
yes,
Pete Schwartz.
Speaker of the House.
Okay.
Thank you, Paul.
Very good. So I want to just do in this case, a pretty quick rundown of the status of the pandemic using the data released around midday today. We are averaging about 507 daily new cases of COVID in our state. And while that's about 5 times larger than we really want to see, we'd like to see it down under 100. It's down from a peak of 824 average daily just earlier this month. So it's come down dramatically from its early January peaks, and that's wonderful, but it remains too high. The second figure I follow is what's known as the test-based percent positive rate for the state, and it peaked around 7.4%. It recently peaked around 7.4% again early in January, and just in the past week it has dived. Dove, I'm not sure the form of speech there, but it's down at 7.1%. It has a 2-day lag, so this is as of Friday. And 7.1%, as I like to say, is closer to that 5% level below which we turn green, and the 10% level that we can look at as saying this is really, really bad. Now, 8% was a level that the Division of Public Health and Department of Education said was a gating threshold to go into red back in September, and it's now viewed as a community spread level. But 7.1 is a big reduction from where we were, and it continues to be falling downward, which is nice. On a county basis, as of I think it was Thursday, Newcastle County was at 6.1%, Kent at 9.9%, and Sussex at 9.5%. So we've had a better job, a better success at keeping the rate lower in Newcastle County recently than in Kent and Sussex. And then the last figure that I report on regularly is the level of hospital rooms that are in use in Delaware. we're at 315, again, coming down sharply from a peak of 474 just 18 days ago. So again, a pretty dramatic reduction, and that is wonderful. But it remains, again, too high. We certainly like to see that under 250 at least. So at 315, we're certainly getting there, not where we need to be yet, but it's far from the worrisome mid 400s that we were at for a good amount of January. Dave, any comments there?
Yeah, the number 300 is kind of it's kind of a target above which it's a real burden on our hospital staff. And we're hopefully going to continue to move down and move below that. There's been some people who publicly say, well, we're not at capacity, so we don't have anything. We do have a lot to worry about. And that is quite a burden on a lot of the people who are principals and the kind of people who get a little bit of relief when that number drops below 300 are people who help out on these pods or that where we're doing the vaccine events. And so as we get more vaccine, which we've been promised from the feds, we want to be able to get those things going and going quickly. And we're gradually doing, I think, a little bit better job at the events with respect to things like wait times. And hopefully we'll get through the 1B in a much quicker fashion than we've started out.
And unfortunately, we're still averaging under 20,000 doses arriving in our state per week, and you can't administer more doses than you have. So we're averaging. We had a good week before that as far as number of doses, but we're still very limited by that, and we're ready as soon as the federal government gets more doses to us. We're ready to get them in the arms. We've got tens and tens of thousands of 1B seniors waiting for their invitation to set an appointment, and we have a lot of 1B employees, including our educators, who are very anxious to get their doses also. But we need the doses, and keep in mind, half the doses coming in really have to be going to second doses of those who've received their first doses within that certain window. So we're slow going right now, but at this point, and we're hitting a tangent, but it's a good tangent. We had some rough patches, some stumbling in those initial sort of mass events, but we're running it really well. Dave, you were at the Chase Center yesterday, right? And I am hearing glowing praises about that.
It was phenomenal. Last Saturday was the worst. Sunday was a huge improvement. We did almost as many in 3 hours less time. And then yesterday, we had 1,899. That was the last number I heard, and that was 30 minutes before now it was slowing down. A lot of people came for their 3 or 3:30, a half hour, an hour early, and we just were able to get through it. It was a beautiful thing. They're already talking about the logistics for expanding upon that and actually separating both sides of the building for 1B and others, or maybe the subgroup of 1B, like, for instance, teachers and people who might be a little bit younger. We found that there's a number of logistical reasons why those of us who are a little bit older take a little longer to get a vaccine. We tend to wear more layers of clothes. Some of us need a walker or a wheelchair. We had wheelchairs there. I bet we had a dozen or more, and we cleaned them off between uses. So, they were very careful. We didn't have quite the social distancing we wanted early, but that was because so many people were lining up that we did not want them to stay out in that cold. It was bitter cold again, though not as windy. We tried to encourage people to go back to their cars until it was their time, but people were anxious. We were supposed to start at 10. By 10 o'clock, we had over 150 people vaccinated. So it was a beautiful thing, and it helped keep that pileup from occurring, though there was a little bit just in the beginning. Most of the delay was very manageable, and we had volunteers there ready to. You didn't have to bring your own wheelchair, and you didn't have to push it. We had people who were ready to do anything and everything to help make it happen. The governor did swing by for a little bit also, and it was an event that I think our DPH and the emergency people and DelDOT, they're learning a little bit more each time, and we're getting a little bit better. We didn't have enough handicap parking, for instance, but they were out there and they were actively assisting, and we ended up getting through it in a what I thought was a very encouraging manner.
And I've heard good things from earlier in the week, or I guess now last week, the Del Tech Wilmington campus event seemed to have gone smoothly also. I think it was presumably with smaller numbers, but I think it was another pod that was smooth. So it seems like we're figuring out the pods, the mass events, really big improvements just in the past week on that, which is nice to see. I was also very appreciative of the communication from DPH and from the governor's office. Last Sunday morning, we got an email with the update of, okay, here's what didn't go well on Saturday, and here are the steps we're taking so that we think we're going to have things with better results on Sunday, which they did. So, and for that matter, throughout the day on Saturday, there was no ostrich going on. There were, posts from DHSS on Facebook saying, things are slow, you got hour waits, we've got some problems, we're working through them, but it was letting people know what to expect. And I really appreciated that higher level of communication last weekend that really, frankly, wasn't needed this weekend because of how smoothly things have gone.
We do have more pharmacies coming on board, though, to the extent that they are on board. I think most of them have scheduled all of the available vaccines that they have. I did find out yesterday that each vial is supposed to be 5 doses. Pfizer and Moderna said you're pretty sure you could get at least 6 out of each of them. We have only pharmacists doing the draws, and we have really good pharmacists in this state. I heard yesterday the stat, I haven't confirmed it, but it was from a pretty good source that we're averaging 6.25 vaccines per vial. So we're stretching our available supply as best we can, and hopefully that will help everybody.
That's great. That's great. On the vaccinations, there was a flyer that I think I posted earlier today, and at the bottom of it, there's 7 things to point out. And number 1 is the 3 ways to contact. There's the website to go to. There's the 800 number, because there's a lot of people who are eligible in 1B who may not be comfortable in using the website. So there's an 800 number, and they'll walk you through the process. There's an email address. Just above that are the 4 different paths to getting vaccinations. And we've got the mass events like the DMVs, the Chase Center, the Del Tech campus. There's the pharmacies along with the grocery stores, so in your neighborhood locations. There's your healthcare providers, both the hospitals, but also doctors' offices and clinics. And the last is the employers. And that's one that, while the healthcare employers have been doing that through 1A, but we haven't really yet ramped up any kind of employer provided vaccinations, but that should be coming soon. And it's just, we're walking before we run. We want to make sure that it operates well. Obviously, these vaccines have very special handling required. So it's not just, I can get these vaccines to you on Thursday, and you can just keep them in your desk drawer until Monday, and then get your employees to come by. There's a lot of requirements to doing it right, having the reporting right. So we don't want to rush the employer path. We just want to get them ready so they can do it well when they have it. Anything more on vaccinations, Dave?
I'll probably think of something later, but right now I think we can move to. Go ahead.
Actually, if you would, because you are there, can you talk about the Medical Reserve Corps?
Yeah, the Delaware Medical Reserve Corps is now there's medical and non-medical ways you can sign up. My wife is medical. She's a nurse. She was there yesterday doing the vaccinations. They're non-medical. We need probably 3 times as many non-medical people to run a pod. That's the people who register you when you come in. That's the people who tell you where you need to stand, or try to get the lines to move properly. And there's also some assistance post-vaccination. They like you to stay around for about 15 minutes. There's about 5.5 per million doses is a bad reaction, and usually that's pretty quick. They also are passing out, and it's usually not the person who vaccinates you, it's usually another volunteer, a sheet of paper or a packet that has stuff about VSafe. VSafe, they want you to sign up. It's actually pretty good what we're getting now. We think we're getting a better sign up rate. We have kids who are signing up their parents who got vaccinated because they don't have parents might not have a smartphone, but you get a text message every day for the first week, and it has questions about how you feel, whether it's severe, moderate, or mild, if you have pain or anything else, aches, whatever. And then like today, I got my second week. It's every day for the first week. It's weekly after that, and then you get a notice eventually for when you're due for your next dose. People who don't sign up and lose their card and forget what vaccine they had. We can try to look it up, but there have been a couple of cases where things fell through the cracks. The CDC advice is if you don't know what their first one was, just give them a second dose. And there's actually a little bit of, I don't want to encourage people to do that. Please try to remember what your first dose was. At least remember the day and where you were. We could usually figure it out. But, there's a lot of, as we've gone through, there are 4.5 million Americans have had 2 doses. It's quite a bit more have had their first dose. And as we start to fill in the gaps, we're learning more. The science is developing. The science around 2 doses of the same vaccine is getting to be pretty solid. But we are learning more things, especially around things like the variants and some of these other wild cards that are starting to enter into the picture. They do believe that the UK version is going to become the dominant version in the United States. It's apparently in so many states that it must be relatively active in community spread. But so far, I'd say they're encouraged by how the vaccines are holding up to the different variants. But both Pfizer and Moderna, and I guess others also, but I have heard specifically about those 2, are already doing slight adjustments or working at the experimental level with slight adjustments to their vaccines. This is what we're doing constantly with the flu vaccine, and they're already applying those practices to this to hopefully stave off any real problems.
What was I going to say? Darn it! I had a really great piece of insight there. Vaccine. Oh, I know. When you get your vaccine card, if you have a phone, take a picture of it. So even if you lose the card, you've got that, and it's going to have the date, and it's going to have the card. So even if you lose the piece of paper, you're still going to have it. So consider doing that. I want to mention testing. Even though the vaccinations are happening at a relatively slow pace, still the testing is very important. It's ongoing. There's 3 Newark events this week. One at Dickey Park along Madison Drive on Tuesday, one at the UD Laird campus by the Christiana Towers on Friday, and then our wonderful weekly Saturday event at the Star campus. So, these are 3 of the many free testing sites across Newcastle County, the pop-up sites. So, look there. Again, that's posted on Facebook. All right.
You can sign up, by the way, for the Delaware Medical Reserve Corps online. And if you're non-medical, you probably don't have to go through any modules or tests or anything like that. If you are medical, there's other things you need to go through in order to work on the medical side. And there are medical people who do the take-in and the injections and other things at these different at these events.
And my wife Pam has been with it for a while, working on the animal side of things or being available on that and trained for that. I got signed up last week going through the process, and indeed it is a painless process, although I must say I'm a little intimidated about standing for 10 hours out in the freezing cold in January and February, but we'll see how it goes. I know that you've done it last weekend, so
I think we could do another event at Chase and use both sides of the building, and there's enough parking there, I think, too, to be able to handle it. We would have to have some mechanism for getting either the younger people or the older people who are more ambulatory to park distant, so that the older people can get those close spots. And we just hope that people use their good judgment and realize we're all in this together, and we're all better off when others are vaccinated, because we are seeing some places around the world, as higher percentages get vaccinated, that there's reductions in community spread, and that's really what we want to get.
So so our plan is to go through a few set topics, and then we're going to go through the questions, both the pre-submitted and the questions entered today or entered during the event today. So our next set topic is the governor's recommended budget for fiscal 2022, which begins July 1st of this year. Dave, you served on the DFAC in the past, and you are one of the prime sponsors, I think, of both the budget and the big budget, the little side budget, and the capital budget. So any highlights you wanted to lead with on this? And I've got the slide deck, and we can go over some of the highlights.
So there's a lot of talk about what's not in the budget. There's not something for retirees. There's not something for purchase of care. What's the third one that seems to be getting the most traction right now? I'm drawing a blank, but the story isn't over. This is the GRB is governor's recommended budget. The Joint Finance Committee now has it in their hands. All four caucuses are giving their members on Joint Finance feedback about what priorities we would like. There are things in there that are very good. I don't think anything the governor's proposing is bad, but there are things that I would suggest might be higher priority. The state employee pay raise is $500 across the board. There are some who are saying, look, only people who had steps last year got an increase. We don't like going 1 year with nothing and another year with something that's small if we can afford more. And so I know that Trey Pardee is the Senate chair. And he's going there with the attitude that, look, we're going to look at this. We'll probably peel some of what he wants off and add some of our own stuff. But if the DFAC revenue estimates go up, there are some things that we really want to see increased. And retirees. One of the arguments is, well, people who retired from Chase or DuPont or some of these other local companies, Bank of America, they don't get pension increases. That's right. But they always have very aggressive, either revenue sharing or 401k plans where there's a good employer incentive for you to save. When you save, they match or whatever. And, for most people from DuPont, where I worked for 34 years, we rely more on our 401k than our pension. And, the state employee pension's a nicer pension than the DuPont pension, but we don't have that matching money for deferred compensation. We do have a deferred compensation, it's a 403B or whatever it is, Paul, I forget.
457 and 403B both, yeah.
Yeah, and, you can save, but it's not going to be as productive to save through the state plan as it is through a private employer plan. So, it's, you got to be able to argue both sides to be able to make a case. And I've directly seen both sides. So, we're hoping that we can do something for those most in need. The people who've been retired the longest, every once in a while, we'll do something special for them. A couple of years ago, we didn't do a retirement increase. We did a one-time retirement kind of like bonus, because when you do an increase, it stays into the base and it continues every year. Well, we weren't sure if we'd be able to sustain it, so we did a one-time. That will be discussed, I'm sure, too. There's a whole lot of tools in the box, and we'll see which one's best or most appropriate for this year.
So I think some of the big pieces is that, let's talk like the 50 million ones. There's the courthouse in Sussex. There's the clean water program to do some initial big funding of that.
These are capital budget.
The capital,
yeah.
But just plain big dollar pieces. And there's a lot of dollars for the growth in school students, just as far as the unit count and a number of students. Don't have the figure for that at my fingertips, but those are big pieces. There's pieces about criminal justice reform as far as the body camera funding is in there. There's pieces tied to the education lawsuits for funding. So it's larger opportunity grants, better funding for special needs K to 3. There's just a lot of programs in there that have been priorities for Delawareans, for legislators for quite a while, that are in there that you can argue are overdue. So it's nice to see them proactively in the governor's budget.
And it's nice to see they're splitting up, because there's legislation in addition to the budget. The two bills around the opportunity grants. One is specific to the special ed, and Representative Kim Williams and Senator Nicole Poore have worked very hard on that area over the years. They are the lead sponsors of that bill. It's a House bill. The part that deals with language learners and kids from poverty, Laura Sturgeon, it's a Senate bill, is the lead sponsor. I think Kim is the lead House sponsor of that also as chair of education. But Laura has lived that. She's been a language learner teacher, and she's had a reasonable share of students in poverty. She's lived it and she's seen it. She knows how valuable this money is. She'll advocate for it. She'll be very articulated in fighting for it.
You see, education. We have the county ombudsman, which is part of the lawsuit, making sure there's somebody who's really independent of Department of Education, looking at issues of equity in our schools.
Not just independent of the department, but also not a state employee at all.
Contracted.
Right?
Yeah.
Yep.
And then the mental health supports in our schools, almost $20 million for the growth, the enrollment growth. And then the salary increases, step increases for teachers and paraprofessionals. So a lot for education, a pretty good amount for our three higher education institutions, Del Tech and DSU and UD. And it's, as we normally do, sort of split amongst all three to their unique needs. And healthcare, there's just, most often there's a growth in Medicaid. We've got some substance abuse, additional dollars, working with supports for those who are aging, those with disabilities. I think there's an increase in the rapid rehousing or other supports for getting people into permanent housing. And then healthcare provider state loan repayment program. This is, again, helping to bring, I assume that's for primary care physicians, Dave. Does that sound right?
I think so. We've been working on that.
We, like most states, have challenges in having enough primary care physicians. Most doctors just find it more, I'll say more doctoral students find it more profitable to go into some specialty, let's say plastic surgery or something, rather than serve as a primary care doctor. Well, frankly, we need more primary care doctors than we have right now. So we're trying to have Delaware be more attractive. We have the Dimer program. Since we don't have a medical school in Delaware, it provides access for Delaware residents to get into set slots in nearby medical schools. And then this program, which I believe gives an advantage to Dimer, people who've gone through the Dimer path, is a way that while you stay in Delaware and work as a primary care physician, you have payments towards your student loans, which for doctors are gigantic when you come out of medical school. Dave, was there anything in the capital budget that jumped out that you wanted to talk about?
Well, you hit the higher ed stuff, and there's actually two parts of that. There's the 10 million each, and then there's the kind of innovative fund. I forget what they're calling it now, but there's a second bump that goes in equal share to UD, Del State, and Del Tech. They're actually doing some important work right now in the pandemic. They're helping to prepare a lot of our first responders and professionals. The people in the nursing classes are still going to clinical. They're getting their vaccines. They're also respiratory care and all the other, not to mention paramedic training and all that. So there's a lot going on in a lot of our higher ed institutions, and most of it's remote, but there are some things like clinical rotations that you're going to do those hands-on, person to person. And so it's important that they're continuing to function the way they are.
So I think that the highlights are, given how crazy the world has been economically for the past 3 years. It's, I think, especially good looking back that we got on this budget stabilization path. It's one where when we had a really good year, rather than spending all the dollars, we spent a good amount of it, but we also set aside a good amount for lean years. And the definition of a lean year is when you have a once in a century pandemic and you lock down the state partially. So, we were not getting the revenues that we were counting on for fiscal 20 and fiscal 21, but we were able to tap into that. So now we have revenues are projected to be much stronger next fiscal year. So not only do we have our normal growth of the state government, but we're also replenishing that fund for the next time we have lean time. So I think we just have almost a textbook case of responsible planning for our government. And so we look at the steady base of that operating the state government that increases each year with normal costs. And we try to make sure it doesn't leapfrog and go too fast. If we have extra dollars, number one, we want to replenish our little stability piece. But we also, if we have some excess, well, that is one-time excess, so we can't count on that. So we direct that towards one-time uses so that we're not sort of addicted to continuing that program. And that's been designed, and that's been the partnership between the governor and the legislature on that. And that continues in this, as our predecessor, Representative Dennis Williams, used to say, the governor proposes and the legislature disposes. And that's our partnership process for handling the budget in the coming months.
And it is important, there's some of these things that when we're in a really tight time, we've even cut things like farmland and open space, but you don't want to cut those below where we automatically get some federal match in both of those categories. And so you want to get the minimum, you want to have always at least that minimum amount where you can get the full federal match. There's also some water areas where we get a federal match. And so if we get 50 million into it this year, as the governor's proposing, we're way above where we get a match, but we're way behind where we need to be. And so it's important to do some one-time stuff in these critical areas that have been lacking for frankly quite some time.
Anything else on the budget, Dave?
I think we've covered, we're going to have plenty of opportunity to talk more about the budget in future weeks.
So you mentioned we had 9 legislative days this month. 6 of them were pretty active on legislation. There were 6 or so bills I wanted to touch on. We have our local service fee bill that we can't not talk about, the unemployment benefit fee bill, invasive species, equal rights, the renewable portfolio standards, and educator evaluation. So I think most people who listen to you and me have heard the local service fee, but this is it's been an 18-month process of working with municipalities and with the Newcastle County government. And we have found a acceptable consensus level and unanimous support of this task force that met 17 times. And it made it through the legislature this month so that it can be relied upon by the parties, by the county and the municipalities in starting to plan their fiscal 23 budget. And they need a lot of lead time because this is a new system and they're expecting there's going to be questions, and those questions are going to take time to iron out. So they need to start early so that communication is good and they can go through the backup mechanisms to resolve any disagreements so that we can have smooth sailing when it goes live. And Senator Sokola and I were the ones who led that through its 18 months. I think we're both pretty glad to have that accomplished by the legislature.
So what's interesting is within, I think, minutes of when it passed the Senate, Representative Baumbach sent an email to the governor letting him know that this bill needs to be signed by a certain date or we lose a year on the implementation of it. So, or the implementation of certain parts of it. So it's just like Paul to stay on top of something like that. The governor's office did respond to both of us that we're going to have our attorney look over it, make sure it's good, and try to be prompt about getting this bill through. So it's not done, but we are cautiously optimistic.
Yes. It's a 25-page bill, so it's going to presumably take the governor's office a little bit of time to look through it all. The unemployment benefit tax-free feature, I think that was House Bill 65, if I remember correctly. Senator Walsh and Representative Osinski had this bill, and it does several things, but I think the key for people on Facebook here is if you received unemployment in 2020, those benefits will be on your tax return, but they will be free of Delaware state income taxes because of this bill that both chambers passed in our very limited amount of time in January. And I think everyone is very happy to see that.
There has been discussion at the federal level of trying to do the same thing at the federal level. Had they done it in the December bill, as some people were pushing for, we wouldn't have had to do that bill because we track federal law. So that's why there was an urgency. People start filing their taxes within the next week or so for 2020. And we did our part. Hopefully they'll get on the stick and do their part.
Great. So there's an invasive species bill that I think by July of next year prohibits retailers from selling invasive species at locations in Delaware. Does that sound correct?
Yeah, it's a list of invasive species that have been identified as particularly damaging. And I believe there's also a process. There's an invasive species board or task force or something that can add to that list over time. They actually worked with the industry and in fact, some members of the industry actually brought the idea to the legislature because they realize how bad invasive species can be for so many things. I'm a beekeeper. They're not good for bees, but they're also important for so many other areas, and they don't want to stop selling an invasive and the person down the road pick up the area. There's a lot of them that are very common and relatively popular, but when most of us find out, I had some Bradford pear trees. When we moved in, they were cheap at the nursery, and so we got them, and I never realized they were invasive. They're all down. I got rid of them. I got a black gum tree now, and one of the local dogwoods that are in place of the two Bradfords that I used to have. We are getting rid of, and it's hard, the burning bushes. There's a number of them, and I'm just trying to do my little part. But the industry worked with Stephanie Hansen. They wanted to have that year lag. A number of the local businesses are going to be a little bit more aggressive this year at not selling anything that's on that list. But by next year, they won't be able to. And the fine, there's a fine in there, but it's more we want to encourage people to comply rather than to punish.
I had a colleague in the caucus talking about it, and they said, if this includes bamboo, I'm all for it. Bamboo is the scourge of my existence in my district, and we'd love to see no propagation of bamboo in Delaware. The Equal Rights Amendment, the second leg, was passed by both chambers and doesn't require the governor at this point.
We don't have to worry about the governor on that one.
and that was for race and color and country of national origin. I think that's correct. So it was nice to get that done and done quickly this month. The SB 33, the renewable portfolio standards, the 40%, but also very importantly, clarifying legislative intent for decisions on the increase and where DENREC's responsibility lies. Do you want to talk about the urgency for this and that aspect, Dave?
Yeah, there was a lawsuit between DENREC and the Public Service Commission, and I think it was late the first week of February, maybe it was early second week, there was the next hearing date set by the court. This will make that kind of go away. There was a jurisdictional fight over how to deal with certain energy issues. This piece of legislation resolved that. The court is happy about that. DENREC and the Public Service Commission are happy about that. And, it helped that Stephanie Hansen did an energy forum the first Friday. She's been really open and transparent. She had a very long committee hearing on the bill. And, when you're that inclusive and open and transparent, even some people who come out wanting it to be more or wanting it to be less, and we had a little bit of both, We were able to do what I think was the right thing. I would love to see 50%. But the main thing was to get that lawsuit resolved. And I think 50% is going to more than take care of itself with some of the advances in technology that are occurring right now. And I, frankly, one of the reasons I wanted 50% was because we're still lowest or tied for the lowest in the East between Maine and North Carolina is at ball at 40%. So we're not as aggressive as a lot of us would like to see, but I didn't want the perfect to be the enemy of the good and us to get nothing out of it. And there were some people who had some heartburn. There were some people who voted against it at this. And, we needed to get that through now. And she's immediately starting next Friday is another energy forum. She wants to pursue a higher renewable portfolio standard. The advocates are working with her. And I think we're going to get something, but we're going to be able to back it up with even more data than we had at this time. She's going to be a terrific chair of the Energy Natural Resources Committee. And the vice chair is Trey Pardee, who's really up to date on a lot of the important information. And you haven't seen the end of energy bills in the 151st General Assembly. I can assure you of that.
And of course, tied to that, that the next effort on this includes community solar, and that has such advantages in making it much more accessible to lower income, maybe non-homeowners, those who live in an area that's wooded and doesn't get a lot of sunlight. So it brings solar energy in a affordable way, an efficient way, good for the system, good for the state, but also much more accessible to all Delawareans. So I'm really pleased that that's also part of what our next step is the bring it up to 50% and also working on the community solar. Dave, the last piece I want to talk about is the educator evaluation system in the period of distance learning and zooming in and all the different ways that teachers are being pulled. What was the goal of this piece of legislation?
So educators weren't trained to teach remotely prior to about a year ago. And evaluators weren't trained how to evaluate people while teaching remotely. There are some good things we've learned. There are some examples of people recording themselves and then going back and reviewing it and using what they've learned from seeing themselves, which is, by the way, one of the requirements to get national board certification. You've got to, record yourself and you've got to be able to differential instruction, teach the same thing multiple different ways. We're learning some things and hopefully we're all going to be better for it, but it seemed like not a good use of time in light of all the needs that we have right now to put the constraints into the evaluation system that were already built in. It does not mean we're not testing this year, and there is a request from the Council of Chief State School Officers, CCSSO, to have the federal government waive that requirement this year. Under the Trump administration, they did not do it. I know they're requesting it again. Don't know if the Biden administration is going to do it, but I do believe that if there's testing this year, they're going to use an abbreviated version. That's not an announcement. I know that there's discussion of that, but to the extent that we have school time, in person or hybrid or remote, there's a lot of incentive to try to focus more on instruction and less on the kind of comprehensiveness in a state assessment. There's still a long way to go on that discussion, but that's one potential result. We may or may not see state testing. We may or may not see it required. It's still nice to have a finger on the pulse of how students are doing, but we probably don't need the comprehensive, time-consuming tool that we have right now.
And logistically, it could be extremely challenging to do it with some certainty and rigor.
Especially when you have broadband issues, and so even people who have broadband, sometimes when mom or dad are home working, one of them will get cut out, and that's not a good thing during a test, for that test. So we'll see what happens, but it's actively under discussion. This bill just deals with the teacher evaluation part of it. We thought it was the fair thing to do. I think it went through pretty much unanimously. I think in the Senate it was, assuming it probably went through that like that in the House. And I think it was a good signal and a good message to send.
You mentioned internet throughput, and I'm reminded that Comcast was looking to add for Delaware consumers the same kind of fee that they've had in many other states of when you get above a certain level of use of data, they can either cap it or charge you more for it. I know that Representative Krista Griffiths, one of our colleagues who's head of, I think, the technology committee, has been working with them and asked for them to delay it 6 months. They've delayed it 4 months, I think, till at least August. And her concern is, as Senator Sokola points out, we've got homes where we got people bustling in there, and it could be two parents working from home, and you've got maybe two kids doing their Zoom meetings, and just an awful lot of data usage, which is necessary during this once a century pandemic. And some of them, they just don't have the extra resources to pay another $30 monthly fee or whatever it happens to be. So I was glad to see that collaboratively. Well, number one, I'm glad to see, this is Charlie. Hello, Charlie. Glad to see that we were able to work with Comcast and get that delayed, and hopefully we can keep it delayed until we get past this pandemic, and hopefully past this pandemic is not that far off, so we can all look for a faster end to this. Dave, you've got a few bills that you're prime sponsor on. You've got the live streaming of college board meetings, redistricting the districts, and the emergency access to EpiPens. Do you want to talk about one or more of those?
Sure. The live streaming is an idea that came up last year when Representative Smith wanted the legislature to live stream, something I've wanted for a while and something I've seen other states do. But now we're doing it, and we're doing it with committee meetings, and we're kind of doing it out of essential need. This would require the University of Delaware, Del Tech, and Delaware State to use live stream technology, and also make the recordings available to the public. I've already had some good ideas from constituents about how maybe to even improve on this, and we'll certainly consider some of those ideas over the break. But I would like to move this bill, get it through committee, and try to work it on the floor. Because of the way it is, it does require a 2/3 vote. So, I can't lose any people on my side of the aisle, or I got to pick up people from the other side of the aisle to get it. I think that we're going to have it in a form that most people will be very supportive of.
That's great. Okay, thank you. So I've got the earned income tax credit, which I was pleased to see that's in the governor's budget brochure, the things that he's looking to be supporting this year. The candidate office helping microbreweries. Senator Sokola and I have worked on that. There's a issue where if you're starting so think about a sub microbrewery. So you're just starting off a microbrewery. You may not want to buy all the materials for brewing beer, but you may have a friend who runs an existing microbrewery. You'd like to use their equipment. This is something that absolutely is done, and it's done in other states. We don't permit that currently in Delaware, so we looked into this issue and we found what other states are doing, and we've drafted a bill for that. And then the second other bill that I want to mention is, and I've been working on this for several years now, is a bill to limit the initial term of office for school board members from 5 years to 4 years. I've tried 4, I've tried 3. I think we've got some really good support to bring it down to 4. And the purpose of that is to make the office less intimidating to candidates, so it can open it up to more candidates. And it also empowers voters to be able to share their pleasure or displeasure with school board members more frequently. And hopefully it will lead voters to do less cases of taking out frustration of board members on referendums. If you don't like how a district is being run, then run for the board or vote against a certain board member and for a different board candidate that you think is going to do a better job. But I ask you not to take it out on the children by voting against referendums. So the way to do that is to make it to empower the voters to have more say in their board members by having a faster amount of time. And every 4 years, 4 years is a long time. I'm elected every 2 years. I think 4 years is more than enough for a chance for the voters to be able to have a say in you continuing to serve your school board.
And the Senate gets 2 4-year terms and a 2-year term during a 10-year period. So a senator would stand for election 3 times, a rep would stand 5 times, and a school board member would only stand twice. And we're dealing with everything, public safety budgets, health and social services, education, transportation, public safety, all those things. And school board members have a lot on their plate. It's important what they do, but they can certainly stand for reelection a little bit more frequently. And, your kids are in school for 13 years. So there's going to be a natural turnover for, usually people are on a school board while their kids are in school. Not always. There's some notable, phenomenal board members who've been there long after their kids were in school. But it's something that seems to make sense. There have been people pushing for this for my entire term in the Senate, and I think as we get more younger people and more people like Paul who've always had a really good finger on the pulse of the local community, I think the legislature, the form of it right now, has a really good chance of getting something like this through.
We've got some other topics, but we've gone 50 minutes without getting to people's questions. So how if we just go to the questions? And in case you're wondering what that Valerie McCartan block on your screen is, Valerie works with Dave, and she's been following both the pre-submitted questions and all the comments here. And she's going to unmute herself and maybe some lightning rounds or long questions and answers, whatever it seems most suitable. Valerie, what do we got?
Okay, good afternoon. We have a number of questions about going back to the vaccine. So I'll try to cluster those together. One of the pre-submitted questions was specifically regarding teacher vaccination and some mixed information that they had received from local pharmacies. Is there anything that you can share with everyone here today specifically on vaccinations for teachers?
So, Dave, do you want me to start on that?
Yep.
Okay. So the Department of Education shared information about the educators' plan, the plan for vaccinating educators, about a week and a half ago. And it did indicate that they would be providing updates. I think it's, I'll get the website in a second. But it's going to include the pharmacies in your local grocery stores. It is possible they'll have drive-in clinics at your schools or at one of the schools in your districts. It has been starting slowly. It's been starting slowly because our vaccine supply has been slow, and the federal government and the governor's following it. Sorry, the cat is a little bit interested here. The governor's trying to really push the 65 plus portion of 1B initially. So we've been a little bit slower to start on the educator and the other employee members of phase 1B. But it should be starting up, picking up. The question, I think, also included the question of, is it going to take until the entire month of February to get teachers vaccinated? I think the answer is yes. I don't think you're going to get second doses and all the teachers looking for vaccines by the end of February. I think it's going to go beyond that. Just the numbers of eligible educators and the lower number of doses we have, along with all the seniors in 1B. Realistically, it's going to take weeks to get all the educators their 2 doses, and it could be 2 months to get the second doses in the educators. So that's that's my take on the realistic timeline. And I think it's like all these things, both the testing and the initial vaccines, it's always starting frustratingly slow, and then we get some kinks out, and then we start operating it with more cylinders going. We're nowhere near that on our educators. Maybe 2 weeks from now, we'll be in a much better state. But it's been glacially slow thus far.
I agree 100%. And I do want to assure you that we are fighting to make sure that we get educators sooner rather than later. It is important for kids to be in school if that's at all possible. It is much more possible if our teachers are vaccinated. Especially with these new variants coming out, the sooner the better, because these are people who are pretty much on the front lines. They're exposed to a lot of people in a congregate setting, and the science says those people need to be vaccinated.
The website is, and Val, perhaps you can type this in, it's de.gov/K12 vaccine. de.gov/K12 vaccine. That's where updates should be provided, but I don't believe any updates have been put there in the past week. And this was put out around the 19th of January. So was that 12 days ago or so?
Okay, your next question is specifically about the group now, seniors that are in 1B, and concern for sign up on social media, which may be confusing or difficult for seniors. Are there any plans to assist our seniors through this process?
So there is again the 800 number, and I think you can probably put that up on the in the comments. That's one service. I would imagine that the Division of Public Health will be partnering with our senior centers to help there, and also have the service centers and the community health centers work to help those who need assistance in the process of signing up for vaccinations. And you know, the 800 number was set up on day one, the same day that you could go online to do a registration for vaccination. You could just call the toll-free number, and it's designed for those who need that avenue. I again would imagine that we'll keep improving and having outreach from our senior centers, from our community health centers, and our state service centers for our seniors.
A lot of over the last 2 weeks, I was at DMV in Delaware City last weekend and at the Chase Center this weekend, and there were a lot of adult kids who were bringing in their parents with their cell phone. They had filled it out. They had the confirmation code, and they were doing what they can. It's important. Not every senior has someone who can do that for them, though. So we really have to push that 800 number as much as we can, and we have to reach out and go out to them. To get opportunities for those who don't necessarily have the technology and the access.
Next question is from Kenneth. A healthcare worker told him that you should not take NSAID analgesics if you have a reaction from the vaccine. Have either of you heard about this? Do you know anything about this?
I think my answer would be I would send an email to the Division of Public Health, and vaccine@delaware.gov would be a good place to go. That is way too much in the weeds for me to speak on, but vaccine@delaware.gov is where I think I would send questions like that.
The paper you get when you're vaccinated says a little bit about the different reactions you can get, and depending on which reaction it is, it's contact your primary care provider. Go right into an emergency room. There's different levels for different things. That's another opportunity, I'd say, to stay into that V-Safe program. They are recommending, if you have pain, to use Tylenol or acetaminophen, and that was enough for me. I had a little bit of soreness in the arm, and took Tylenol, was able to sleep. So but it's important that you not necessarily look on websites and stuff unless it's the state DPH or your primary care to get actual good feedback.
And that, David, you mentioned the numbers of something like maybe 5 per million have that strong allergic reaction at the time of the vaccination. Keep in mind, we've got fewer than 1 million people here. So we're talking maybe 5 people in the entire state who likely will have an issue that needs an EpiPen within 15 minutes of that vaccination. So yes, it happens, but it's extremely rare. So 5.5 in 1 million is a really low level, much lower than most vaccines. This is a very different vaccine from any past vaccines. It's an engineered one. It's not the active virus itself. So it has amazing strengths. The fact that they can re-engineer it right now in the first few months for new variants is just it amazes me from a technology perspective.
There's actually three variants of the vaccine, and I can't remember the scientific names for them right.
Well,
But
aren't they South Africa, Brazil, and UK, right?
no, of the vaccine,
Oh,
not
the
of
vaccine. Okay, the
yeah, and
mRNA, right?
yeah,
And then Johnson and Johnson's a different. Is it a different technology?
Yep,
Okay.
yep. Yeah. It's interesting. Paul and I aren't experts on a lot of things, but we'll get questions about vaccinations. Tonight, we're going to get calls about the snow. We're not weathermen, but I'll tell you what, we do make a good faith effort to get as much important, relevant information as we can from uh, important, credible sources, and we will continue to do that.
Okay, next question is why are many people who are over 75 with comorbidities not being contacted by the state or prioritized by the state for vaccinations?
Well, I think they are. It's just there were over 100,000 people who signed up in the first week or so in the online and probably call center system, and we just don't have 100,000 first doses. Indeed, when the system calls you out for an appointment, that's a risk-based system. They're using age. They're using the health information that you respond when you sign into the system, sign up for the system. It is absolutely risk-based. So if you have no health issues and you're 66, you likely are going to be one of the last ones to get that first dose or get the email inviting you to set the appointment for your first dose. It doesn't mean that every 75-year-old with health issues has already received their appointment, but it does mean that they would have gotten invitations ahead of those who are younger with no health issues that are tied to the COVID-19.
We did have, as I said, people in wheelchairs, people with walkers, people with oxygen tanks, and people with other kinds of assistance. And so I don't know all of the medical history of everybody who we checked in, but they tended to be a good deal older than 65, and hopefully we will continue. If we get, as promised, the 3,000 more doses per week than what we've been getting, we'll be able to put a bigger dent into this problem. We're really close on a lot of the 1As. Many of them, if not most, already have had their second dose, and that's going to leave more available for everybody else in 1B.
And I think the progress of DPH in making sure that all these mass events are done by invitation only ensures that it can be more risk-based. The early DMV events where people were being served without having an appointment, it was much easier for someone who is 66 without additional health issues to get a vaccination then. You aren't going to get that email asking you to set an appointment now if you're 66 without health issues because it's all by appointment and it's risk-based, community-based. It's also, we're being really mindful of income groups and other at-risk communities and making sure that they're getting served at least equally with other groups across the state. And it's not just those who have cars that can drive to a DMV event, for instance, to be able to get served with a first dose.
Great. That leads very well into the next question, which is any news on the time frame for second doses? As you know, there are many who have their first dose and now they're anxious about that timeline to the second dose.
So there was a difference of opinion between the CDC and FDA about 2 weeks ago, week and a half ago, and the state has clarified their approach. One of the vaccines, the goal date is 21 days after the first dose. The other one's 28. And I think what the state said is we're trying to get all of them done within 35 days of the first dose, or it may be within a week. So it may be 21 to 28 for the 21 and 28 to 35 for the second. It had been the looser CDC guidelines of within 42. The state has reduced that window and is trying to get it within a week of that initial date. And that was clarified by Division of Public Health earlier last week, Monday or Tuesday, I believe.
I do know a number of people who got their first dose at a pod have been able to get appointments through a pharmacy or primary care for their second dose. If you've gotten your first dose at a pod, you don't have to get your second dose at a pod. So keep all those tools in the box. Contact Walgreens, contact Rite Aid. I think CVS comes on board this week. And they're going to be largely dependent on how many doses they get. And just make sure you have which one you got for your first dose when trying to schedule your second dose.
Great. Thoughtful question here from Jonathan. Is Delaware reporting the demographics of people in aggregate? Early indications are that lower risk, higher socioeconomically privileged are getting vaccinated earlier, which will not help reduce total COVID-19 burden optimally in the aggregate, including prevention of the most hospitalizations practicable.
So indeed, the state's vaccination dashboard does include the demographics of those who've been receiving the vaccines, and also 1A included those in the long-term care facilities, skilled nursing facilities, who were most vulnerable to death should they catch COVID-19, and for that matter, for hotspot spread. So yes, it's being reported. There's a challenge in that 31% of the reported doses given do not have a race ethnicity reported, but anytime the data is reported, it is posted. And again, that goes into the calculation of determining who to invite to make sure it's risk-based and that it's spread equitably across our state residents.
Yeah, and I also, when you sign up, I don't recall there being anything about socioeconomic status on there. And I would just, from observation at the three that I worked, I would be willing to bet they're more affluent. There was not quite the diversity at the motor vehicle that there was at the Chase Center, but not as much diversity at Chase Center as you might expect. And you can't really tell from looking at somebody about their socioeconomic status. But there's active discussion about how are we going to, and they're talking about using mobile units and stuff to go into communities and identify people who are willing to take the vaccine, because that's a little bit of a challenge also. And I know they've assured us they're going to make a good faith effort, but we got to find a metric for them to report how successful they are at achieving that goal.
Well, I think they're also using zip code and hoping that that's going to help and spread out, bringing people from all economic statuses in at a fair, equitable level.
Next question. Do you have any estimate of when 1B vaccinations will be completed? Is there any sense? I know you talked a little bit about that.
So there's something called the COVID-19 Vaccination Task Force that meets, has a public meeting every Friday at 1 p.m. and they update their current vaccination allocation approach with weekly summaries. They have phase 1B having started in late January, somewhere around week 5, and taking as long as week maybe 18, mid to late April, end of April. Now they do see that what they call remaining phase 1, I call it 1C, not waiting until 1B is completed, but they see 1B going through maybe late April. They see 1C beginning maybe early March or so. So these are overlapping phases, just like 1A and 1B overlapped. But because of how big phase 1B is, they expect it to go on for literally months.
If Johnson & Johnson is approved, that could be a bit of a game changer. And that's just a one dose. It's not as quite as high efficacy, but the data on severe cases and death is very encouraging. So if we have that tool in the box, that's another thing that can help us more rapidly achieve the goals that we're setting.
There is both this chart and I'd heard another analysis that says every American who wants vaccination should have the opportunity to have a vaccine by the end of July. So we're starting slow, but there is an expectation that we're going to, I have to use the term snowball, it's snowing outside, and that we're going to be accelerating into this and we're going to then be really it's like our testing. Our testing is at a great level now. It took us a while to build up to that. It's frustrating at the beginning, but we should be catching up, and we're assuming that and hoping that. But there's things in place so that is quite possible.
Testing's a great thing to talk about too, because the governor thought he was targeting a stretch goal when they said, let's get 80,000 a month. And we're at about 200,000 a month now. And so that's 2.5 times what their goal was. But as more testing tools became available, we were able to figure out ways to put them to use and to encourage people to go out and get tested. We hope that we're going to have the same. I told him, I said, well, look, I want to see you have the same success with vaccinating, set a nice stretch goal, and let's beat it by 2.5 times. So, or beat it by 1.5 times. And, hopefully we'll have that kind of success with vaccinations. I know that the volunteers love to be there. As bad as it was last Saturday and as late as we got out, as tired as everybody was, everybody left there feeling good because we got 3,000 people a vaccination. And Sunday, we felt even better because we did it in 3 hours less time. Yesterday was just about hallelujah. I mean, it was such a really great event. We want to expand on those, but we have to have the doses. And if we get them, we're going to get it done.
And one way that we can have confidence that we can do this is by working with proven partners. So the Curative and Vault have been great partners for the COVID testing over the past 10, 11 months. And the Delaware is partnering with them for the vaccinations also. And they should, I think not sure if they were involved. I think Vault was involved with the Del Tech Wilmington campus event last week. And so that should also help us with confidence to ramp up as the supplies ramp up, us being able to deliver those into the arms of Delawareans.
No matter how much Pfizer we get, we are limited because of the ultra cold storage capability. I don't believe any of the pharmacies are able to deliver Pfizer, and I don't think beyond the state and a couple of hospitals, I don't think we are able to use that brand for vaccinations. But we're going to take whatever we get, and we're going to try to get it in arms.
We've been delivering twice as many Modernas as Pfizer doses, and that's on the vaccination dashboard. You can see that.
All right. Next question is about DMV. If one's car inspection is due, can Delawareans still renew that online? Well, inspection would have to be waived and a renewal online. Just concern about going to DMV, potential exposure when they have not yet been vaccinated.
That's one that I don't know, but if you send an email to either of us, I think we'd be happy to get you a quick answer tomorrow. My email is paul.baumbach@delaware.gov. Dave, I'm not sure which of your two emails you want to use.
Do my david.sokola@delaware.gov. I did get a car inspected during the pandemic, but I went out and got it inspected on site. It was my daughter's car, and the line wasn't that bad. You have to get out of the car for them to plug that thing in to check it out. But, it worked.
Okay. I think this is the last question on the vaccine, and there are a few other questions we'll turn to. Do you know what the quarantine timeline is for childcare centers if a staff member realizes they are positive for COVID? Is it still 14 days, or has Delaware moved to 10 days?
We've moved to 10, haven't we?
Yeah, we've moved to 10, and it's 10 after symptoms, or 7 after symptoms. It's 10 after exposure, but if you don't have any symptoms, I think it's 7 days now. I'll have to check that to be sure. I know because one of our colleagues tested positive. She never had any symptoms, and I don't think she missed more than a week of work, and she works at the hospital. So it's.
And I think each childcare has a contact with the Division of Public Health and can get that answer very quickly. But again, those questions, you should never hesitate to reach out to your legislator. We'd be happy to help you get a quick answer on that.
Yeah, I don't know that one off the top of my head, but we'd definitely find out for you.
All right. Now you have a couple of questions from your discussion about the budget. Could you speak more in terms of what is in the budget for open space and ag preservation? Dave, I know you spoke to some of that and how the federal match works and so forth.
Yeah, we have 10 million for each. That's what we've targeted for years. Governor, since he was first elected, even when we were in a really tight time, said his goal was to get 10 million farmland and open space. This is the fourth time in 5 years that I think we're going to do it, and the other time it was close. So, and the other time we did get all that we could get on a match, I believe. So, and there were times during the previous administration where we didn't get all of the match. So 10 million in each is the proposed. I don't know a legislator who doesn't want to get 10 million in each. And I know some who'd like to get more in open space. So, you know, we'll see how that process goes. It will be largely dependent upon what the trend is with the Financial Advisory Council revenue projections over the next few months.
Next question. We've been waiting the FAST approval to permit those who have an interest in secondary school but aren't seed school types, so that they could get the tradesman women certification in place of a degree. Do you know if that is forthcoming? FAST is an acronym.
Is that for teaching in public schools?
It's for other trades too. It's for a whole lot of.
Okay.
You know, I'd have to get back to you on that. I think that's another one of the things that's in President Biden's $1.9 trillion proposal. There's an education, a retraining or a career direction component in that as well. You know, we have a lot of people out of work in the country, and some of those will not be going back to where they were prior to the pandemic. And so there's going to be a significant need in the area of retraining. And, you know, he also has a component about infrastructure that they're going to try to work on beyond the 1.9 trillion pandemic. And some of those are positions that don't require multiple years of school, but may require a credential of some sort that you can get either online or at an accelerated academy of some sort. So we'll try to find a better answer for that for you. Just send me an email.
In the governor's budget, there is a new $1 million for a career pathways program at Del Tech. Del Tech certainly has been very well positioned in delivering support for people who are changing their careers in Delaware. And so this is some dollars to help in those efforts.
Yeah, some of those involve pathways, and some of them are articulated with some high school students who are in trade pathways. And I know Mark Brainerd is really focused on, he's the president of Del Tech Community College, focused on trying to get as many of the needed credentials available at Del Tech Community College at as many campuses. I mean, we got 4 campuses, Georgetown, Dover, Stanton, and Wilmington, and wherever they're needed the most, they're trying to locate the skill set to deliver.
Did I hear Casey, Dave?
You did. She
Okay.
just came in, and she didn't jump on me like your cat did. But
That's right.
Just wanted to point out you had a supportive comment regarding DIDER and the importance of that here in Delaware, dental care, particularly in southern Delaware.
I mean, Delaware is challenged because we don't have a dental school or a medical school. So these programs are very important, or a vet school. It's very important that we have these programs to help Delaware students pursue their careers in the medical field with the same advantages that residents of other states do.
There's a question about the senior property tax deduction. If you were signed up in the past, do you need to sign up again?
Now, once you're in, you're in.
And for those of you who turned 65 in 2020, you have until, I think is it April, March or April? But if you need to get that, just send an email to me and we'll get the application out to you. The deadline has not yet been there, but if you're at least 65, you can qualify for that property tax deduction.
I think it's April 30th. Indeed, it was in my e-blast this past week. I also want to remind, I was talking to somebody a few months ago where the house was in his wife's name and she passed away and it was named of the estate, and he didn't apply. He thought he still had it, but because it changed ownership from her name to eventually to his name, he was going to have to apply, even though he was 75 at that point or so. So if it changes names, then you're going to need to reapply. But if it's unchanged and you've applied once, it's good, as long as you own the home.
If you're a new resident to Delaware, there are other requirements for longevity depending on when you move to Delaware. But that's all in the application.
Some supportive comments regarding RPS and asking, will it include both Harris McDowell's approach and the approach used by other states?
Probably be more the approach used by other states. One of the comments that we have heard quite a bit since Stephanie Hansen did that bill was it was so refreshing to see the bill in January rather than in June. And it could get a legitimate hearing. There was a forum before the hearing. The openness and transparency and inclusiveness was a real breath of fresh air. And I can assure you, you will continue to see that type of activity out of Senator. Senator McDowell was phenomenal, and he knew these issues, and he knew they were the right thing to do. The process was sometimes the issue I had with him, because I do believe in openness and transparency, and I want to see people get an opportunity to weigh in on these. And I don't think everybody has the right to expect veto power over something. We'll make judgments when there's strong opinions on both sides, and that's what we did on this one.
Okay, next question is both of your views on universal pre-K.
Absolutely for it.
What Dave said. And I think that what we need to, well, one thing that we can do is just keep boosting the purchase of care and just making it more accessible for lower income families. That's nice and targeted to the lower income families. There's a lot we can be doing. We have seen so clearly during this pandemic how important childcare and education is, not just for the education needs of the children, but also for the parents to be able to work their jobs. And it's not that childcare and public education is a babysitter, but it has a role in the economic ecosystem of our society. So we really need to have that ability of, we need to, we're going to improve our state's labor force if we've got a dependable childcare and pre-K and K-12 system, so that the parents are able to work to their fullest potential and earn more money for their home, and also help our economy by bringing their best talents forward.
One of the reasons I ran for office in 1990 was because I wanted full-day kindergarten. And that took over a decade to get. Ruth Ann Minner was the one who signed that into law. It wasn't fully implemented until I think Jack Markell's second year. This, I think, has a whole lot more advocates in the legislature. And one of the biggest advocates is Senator Sturgeon, who is on the Joint Finance Committee. She's a retired teacher. She doesn't have kids. She, as a professional, believes this is critical. And this is where we need to go. Certainly Tizzy Lockman and Namdi, and, we have a lot of great, phenomenal young legislators. Some of the ones that were elected in the last 2 years, we had 15 new legislators 2 years ago and another 8 this year. And most of them are much younger, and they all seem to be right on board with advancing pre-K to eventually universal. It's going to take some scaling up. It's going to take some scaling up with respect to the professionals. But we need to make a commitment to do it and to do it right.
Okay, I think we're down to the final question I see in the comments. It's certainly the most immediately pertinent question. Do you know when schools will clarify and announce if they are closing or delaying in-person school tomorrow?
I heard Philadelphia, is it parochial school? One of the groups had already announced Monday and Tuesday everything was going to be remote. But in Delaware, I haven't. Are you looking up online right now, Paul?
I'm going to Twitter.
I,
That's my go-to place.
I will tell you, my wife works at Del Tech Community College, and they were told no snow days this year. You've been working remotely. You're going to continue working remotely. There may be snow days for clinical and other rotations, but as far as any classroom stuff, you're on, and that could change if there's like a power failure or something. But when there's a power failure, it's hard to get the word out. So.
I am seeing nothing on Christina's website, so I've not seen any announcements yet. It's certainly when I see it, I'm going to put it out both on Facebook and Twitter. So keep an eye out there. If you are a parent, you're probably already going to get a text alert or an email alert if the school district does that. In these hybrid days, it's a little bit unique. It maybe they just announced, that it's going to be a switch to an all virtual day, and it could indeed be 2 virtual days.
Real quick story. Last year at the end of February, the beginning of March, I saw Darrell Green. It was clear we weren't going to have any snow days because the weather was already getting a little bit nicer. And I jokingly said to him, man, you finally got to be a superintendent and you didn't get to call any snow days this year. 2 weeks later, COVID hit. And we may never do snow days if we're doing things virtually. But I feel like I jinxed everything by joking with him about that. He still remembers it. We had him for the Interscholastic Athletic Association. He's going to be on the board. He was confirmed. And I can't remember I think Hughes was the other one who got confirmed for that important position in this time. Student athletes have had a tough year, and we're doing the best we can to make sure that their schedules are modified in as limited manner as possible. But sometimes we can't help.
I want to remind people that the city of Newark has canceled their trash pickup tomorrow and pushed everything one day. So if you're a Monday trash person, you're a Tuesday trash person this week, and if you're a Tuesday trash person, you're a Wednesday trash person this week. And keep an ear out for other changes like that due to the snow. Certainly, if you can, stay off the roads the next 24 or so hours, and just stay safe out there.
Hopefully you're used to being at home.
Thank you all for joining us.
Thank you. Please stay safe, stay warm, and stay in touch.
Take care.